Hello, this is Dr. Wells with Wells Medicine, and I wanted to talk today about the return of depression or anxiety versus sort of normal life emotions. A lot of patients, once they have a diagnosis of anxiety or depression or bipolar or OCD, when they encounter a life circumstance that creates emotions that echo that diagnosis, it's very easy to think that we're back in that diagnosis again. And so when patients are going through something that is going to feel bad, whether you have had a previous diagnosis of depression or you were the most, quote unquote, normal, neurotypical, optimistic, elated, joyful, happy-go-lucky person beforehand, some things in life just suck. And there's no easy way to get through them without having a lot of really negative emotions. And there's no easy way to not feel negative emotions. And when you've had a diagnosis before, sometimes they echo the diagnosis that we've had, and it feels like we're going back into that. So an example of that is I had a patient who came in after several ketamine treatments, and she said, I really felt like the ketamine was working, but then all of a sudden last week, it's just not working, and I feel like my depression is just back completely, and I'm just really in a dark place right now. And in talking a little bit about what was going on, her parents were having some health issues. Her job had been really unsteady and unstable lately, and her dog was in the veterinary hospital. And, in talking with this patient, it wasn't that the ketamine had stopped working. It was that she was going through some really big things in life that were going to feel bad. But depression isn't grief, and it's not, sadness about a specific thing that's going on in your life. Depression is much bigger and grander than that. And so sometimes there are these waves in life that, ketamine can help, TMS can help, but also some things are just going to be really hard. And during those periods of time, what the ketamine or the nitrous or the TMS is able to do isn't to create elation and joy. Certainly, I wouldn't want people to be, chortling at their father's funeral and laughing and having a great time and being, optimistic and happy-go-lucky when they're dealing with a divorce or losing their job or a hospice situation. These are true, real emotions that a well-crafted life and a full life has these emotions when we're going through these life stages and milestones. And so I don't even want patients to not have the experience of those things. But what ketamine or TMS is able to offer people during those experiences is sometimes resilience, sometimes flexibility of thought, different perspectives, going back to the important things, kind of going back to values, being able to unfreeze some of our more rigid ideas about things, getting off fight or flight, getting off rumination, getting out of bed, being able to a lot of patients will say, I can handle things. One time I had a patient who was in the active process of a divorce. He had lost custody of his kids. He was living with his parents again. He was dealing with some DUI issues. He had lost his job. And he said, I was never going to be happy during all of this. I didn't even expect to be happy, but I'm signing my divorce papers now. I'm writing my resume again. I'm networking again. I'm dealing with the things that I need to deal with. And before I was in bed with the covers over my head and I was just avoiding everything. And now I'm up and I'm dealing with it and it just doesn't feel good. These aren't things that feel good, but I'm dealing with it. And so sometimes that's all we can get out of the ketamine and the TMS. But sometimes that's enough to get us through those things, because when you're moving through things, it may be very difficult, but moving through in the long term is easier than getting stuck. And in the short term, avoidance feels good, but you get stuck and then you're in the stuck avoidance for longer than you would be if you moved through the negative emotion and came out the other side. That usually is better over the long run and easier than getting stuck in short-term avoidance. There's an expression used a lot in therapy that grief will wait. If you avoid with video games, if you avoid with alcohol, if you avoid with other drugs, if you avoid by hiding, grief will wait for you. And I think anxiety will also wait for you. But the idea is that the longer you avoid, the more time you're spending in grief. And that's not to say we ever really recover from the grief of the loss of a loved one, or the loss of the idea of who we could be, or the loss of, our idea of something. But it becomes less sharp, it becomes less pokey as we move through the process and the stages of grief. And so I really want to invite people not to necessarily feel like life should always be elation and joy and happiness, or even placidness and peace. There are some things in life that just are going to be painful and hard to deal with. But through the coping skills, through tools, through ketamine TMS, we're able to get through them and on to the other side.